All right, Derek, thanks so much. Hey, an interesting pet segment today. We are talking about glaucoma, among other things, with your pet. Dr. Jerome Williams, regular guest with us on Good Day Alabama, and Dr. Jana Korsch-Dismukes is here to talk about that. Hello.
Good morning.
Welcome.
Thank you.
And who did you bring here?
This is Libby Lou.
Libby Lou.
She's my own personal dog.
Well, she's a sweetheart. She's so
Thank
sweet.
you.
Okay, so, hey, darling, look at her. All right, so does she have any of those issues?
She actually does have cataracts.
Really? Okay.
I'm going to be talking about specifically diabetic cataracts today.
Cataracts pretty normal for dogs, or
Well,
is it certain breeds?
Certain breeds are higher, certainly predisposed to developing them.
Okay.
The majority of cataracts that we see in dogs are genetic and inherited, but there are quite a number of diabetic patients that develop cataracts now.
Okay.
And in fact, 1 in 500 dogs will develop diabetes, and that's increased threefold over the last 30 years. Our treatment is so much better that a diabetic now has the same life expectancy as a healthy dog if they're treated.
Why is it increased? Is it the same
Diet,
thing with
perhaps.
food? Is it diet? Same thing with
Diet,
humans?
obesity, we're pampering our dogs a little more.
Where they used to run around the yard all the time, not so much anymore.
That's partly due to that, and then there's the genetic component.
Some more predisposed?
Definitely. There are
Okay.
certain breeds, schnauzers, dachshunds.
Right, okay.
We see that
Now, Dr.
frequently.
Williams, what do you see when someone brings a pet into you that you say needs to go see someone like Dr. Korsch here?
If I see, especially a diabetic patient, beginning to see some eye changes, I try to get them to her as soon as possible so she can save it. But many times, once it's seen, it's too late to save the vision.
So what's the takeaway then from this that people need
Early
to know
intervention. Early intervention. When cataracts are first diagnosed, if the dog is still seeing, we like to document the size and the location of the cataracts.
I think we have some photos to go along with that. What are we looking at
So
here?
that is a diabetic.
It's very cloudy.
Schnauzer who is blind, completely blind.
Some marble eye looking.
And
Poor
that can
baby.
happen in a matter of a couple of days to a week that they can
Really?
lose their vision. It's very rapid. But we were able to perform surgery on this dog and restore her vision.
So she has her vision back.
She does.
Oh, that
there
makes me
she is
happy.
right after surgery. You
Wow.
can see that she has clear eyes and can see again.
That's
and
pretty amazing, the
in fact,
difference.
she has artificial lens implants, just as in
Wow.
people. Acrylic lens implants in
How about
both
that?
eyes.
All right, let's go to the next one.
So this is a view of a glaucoma patient that's
Is
a little.
that protruding out or is that hanging?
It's protruding out.
In glaucoma, the pressure gets so heavy in the eye, it just causes it to explode almost.
Oh, goodness.
So that's the same dog. You can see him, sweet little husky.
What a pretty puppy.
But glaucoma can manifest itself in different ways, and so it may be very difficult for an owner or even a veterinarian to tell that glaucoma is playing a part in the change of the color of the eye. This is after his surgery. He lost vision in that eye and has an intraocular prosthesis there in the dark eye. His blue eye is still unaffected, but his
So
dark
he can
eye.
see out of his other eye.
Yes, and now he has a comfortable left eye.
Because you want to have something in there. You don't want to leave it without something in the socket, obviously.
Sometimes
Or can
pets will, you can, it's not that cosmetic, and obviously they lose the symmetry and the appearance of having
Sure.
two eyes. So many owners, most of my owners will elect to have that surgery performed.
Now, I would imagine it's not cheap. And that's what a lot of people concern themselves with. So,
It is not cheap, unfortunately. That's the downside. More people are getting pet insurance, which is good, but it is a specialized surgery, microsurgery, and the equipment involved is
Very costly.
very costly and
so
very much
you're talking
the
about
same.
the replacement or just the surgery itself to get rid of the cataract?
Well, the cataract surgery is actually performed with human equipment, phacoemulsification, and so
Okay.
it's yes, the equipment that's required to
Well,
do.
you know what you're able to do, and so hopefully if you have that, you can deal with it. All right, you're at Riverview Animal Clinic?
Yes.
riverviewanimalclinic.net, and we know where you are.
Yes, yes. And the takeaway is to get these dogs in earlier to
Early.
specialists like Dr.
So don't miss your
Dismukes
doctor's
Korsch.
appointment with your pets,
That's
just
right.
like we miss with our own. Good to see you.
Thank
Thank you both
you.
so much.